Hi, good morning, everybody. Can everybody hear me okay? All right. It's so wonderful to see everybody. It really is. I haven't seen a lot of you for the last 2 years since we had our last conference. I want to thank Jill for having me here at this conference and being a part of her life, being a part of this amazing community. You all mean a lot to me. Jill's introduced me, but I also just kind of want to, before we go right into the slides and a little bit into today, my experience with acromegaly happened a long time ago when I was working at Cedars-Sinai Medical Center, and I was asked as a psychotherapist to run a pituitary support group. And that's where I first got involved and met a lot of people with different pituitary disorders, and where I was first introduced to acromegaly. And I have to be honest with you, I had to Google it. There was Google back then, but I had to learn more about it and to understand and do the best as I can as a clinician to be in your shoes, which obviously we know physicians and other healthcare professionals, we're not in your shoes. We probably learn more from you than the other way around. So I want to, dedicate today and my work to all of you as well. So I first also want to just say that I'm so pleased to be speaking first this morning. Typically, I'm like positioned last, which is great. So I love the idea that you are all going to have an opportunity today and tomorrow to kind of absorb the slides that I've created to take with you. I recommend you take notes. If there's something on a slide that connects with you and that makes sense to you, and I always say take what you like and see how it applies to your own life. So let's go ahead and start. Okay, so this presentation is going to be focusing on coping mechanisms, right? And so this presentation is also focused on ways to cope with all things in life, right? Not just about when life gives us a big bag of lemons as we have to move through life. So we're going to talk about coping mechanisms. And this is a psychotherapist perspective, my experience working with you and other patients with this rare disease. So why is this topic important? And it's important because it's important for all of us to know individually and where you are in your process is that you're not your diagnosis. And oftentimes when clients come to see me, especially in the beginning, let's say with a new diagnosis, a recent diagnosis, it's such a shock to the system that one thinks that this is really all that they are. And so the work is that separating that's a part of you, but it's not everything. It's important, we're going to discuss today the difference between the physiological and the psychosocial connection between the two. We're going to be focusing on coping and how important it is for you to learn how to cope with different things in your life. And we're also going to learn more about, through coping, kind of who you are and how you want to live your life with acromegaly, because it's not going away, right? It's kind of a part of you. And so we're going to be focusing on that. So I want to identify the goals. We're going to be looking at psychosocial stressors. I want you to identify what your psychosocial stressors are. They're going to be different than with everybody in this audience. I want you to look at social challenges that may come up. I also want to add occupational challenges. So social, I talk about interactions with family, friends, loved ones, but occupational challenges, something that I spoke with a patient about last night that's really important. We're going to be talking about coping mechanisms, and we're going to be doing a little bit of work today on how our thoughts affect emotions and affect ultimately our behaviors. Okay? So let's talk about some of those psychological challenges that come along as far as confronting a diagnosis. A lot of times patients that I work with will question their personal security. We go through life, right? Life is moving along. Things are pretty normal. We're engaged in relationships and work. And then all of a sudden, we kind of have to redefine what is this all going to mean in our life with this diagnosis. I want you to think about how you're incorporating this new information into your life, how this may affect your relationships, how it may affect how you view yourself in your relationships. Also, psychological challenges that we confront have to do with surgery, medication compliance. Oftentimes, we need to ask ourselves with medication choices, how is this going to impact my day-to-day life? How do I want to deal with this? Am I medication compliant? Am I following what my doctor's advising? Am I struggling with any of that? What about side effects? We often talk about side effects to medications. How are we coping with that? How are we advocating for ourselves to learn more about side effects and talking to our physicians about that? How do we deal with symptoms, breakthrough symptoms, balancing treatment remedies? You're going to hear a lot also this weekend about, the medications, but also how do we look into other remedies that may help us with like pain management, other treatment modalities. But I think most importantly with this weekend is looking at how do you maintain all of the above? And what's your view about it? How's your attitude? How are you maintaining your balance with all of this? So let's look at some of the social and occupational challenges that maybe we run into. How are our relationships socially and occupationally? For example, since my diagnosis, have I changed in my relations with others? Am I isolating more? Am I not saying yes to invitations, to social connections? Do I not want to go to that wedding that we haven't had in so long because I've changed? Or do I look differently? Or how are people going to treat me? So the focus here is about you. This presentation is about how you are in your relationships, not how people treat you. It's about how we engage. And looking at occupational work, if any of you are working, how are your relationships with HR, colleagues? How do you manage those kinds of communications when they come up? We're going to deep dive into coping mechanisms. I'm fascinated by how we cope, how the human species copes, how we just get through the day. And so there are, let's talk about the kind of definition of coping. These are strategies, right, that we all exert, efforts, behavioral, emotional, that we use to master, tolerate, cope through life, okay? Coping. We all cope in different ways. There's positive ways to cope. There's negative, maladaptive ways of cope. We all have these coping mechanisms. So there's 5 main types of coping mechanisms that I've created and worked with my patients. What's important to know is that one can use any of these different coping mechanisms interchangeably. The goal is to be aware of how you cope. So there's different types of coping mechanisms. This is probably the most beneficial one, the healthiest one. And this type of coping mechanism where most of us have moments of being and moving in and out of different coping strategies. So this is the fighting spirit. And I'm going to ask for a show of hands in a little bit. This is where the person sees the illness as a challenge. You're actively involved in your attitude, in your recovery. You can see exerting some kind of control over all of this. Has anyone ever been in that coping mechanism? Great. I see a lot of hands. I like that. That's right, right? But it's hard to always live in this coping mechanism, isn't it? Right? When you're feeling defeated or you're feeling dismissed or you may feel misunderstood or whatever the issues are. But remember, it's important to know that this is a coping mechanism that you can move in and out of. This is common, avoidance and denial. Has anyone ever been in avoidance or denial? Okay. Shockingly, that's considered a coping mechanism. Oftentimes, under a huge amount of trauma or stress, we'll find that patients will be in some denial, shock in the beginning, and that denial actually helps us in a way kind of cope initially. We just don't want to live in denial, right? That's not going to help at all. It's certainly not going to help advocate for your needs. And I also want to say that I know there's loved ones in this audience. So this presentation is also designed for you. So as you are here to be supportive partners, but also how you cope in your life. So when we're in denial, we deny the impact of the disease. Maybe we've been going months with some vision change and we don't call a doctor. We minimize it. It's not really a big deal. That distraction can lead to maladaptive coping mechanisms, which can also then lead down the road to mood disorders like depression or anxiety. So I have a quote here from one of my patients: "My symptoms will not go away, and it's really not that bad, not that serious." Fatalism. Anybody been here? Fatalism's where it's a minor threat. I see some hands. There's no control that can be exerted. We kind of live in a passive stance, right? We're not advocating. We're not fighting. We're just kind of moving through life. So it's all in the hands of fate, and I don't really need to do anything about it. Helplessness and hopelessness. Shocking as it sounds, these can be a coping mechanism, but not for very long. You don't want to be living in hopelessness or helplessness. Anyone ever been there with this illness, right? Feeling pretty helpless and hopeless, that there's nothing that can be done. There's nothing I can do. What's the point of going on? These are where emotions were engulfed in thoughts of deep thoughts of depression. If we live here too long, that's where we really need to get some help, and possibly seeking out, therapy, psychotherapy of some kind, reaching out to colleagues, friends that know what you're going through. Anxious preoccupation. Anyone go here? This is a pretty common coping mechanism where we're constantly anxious about compulsively searching, going on the internet, re-diagnosing even ourselves, living on, WebMD. We're kind of consumed with not knowing what the future holds. This is a very common coping mechanism. So most of us kind of live in one of these, and they're interchangeable. And sometimes we can move in and out of these different coping mechanisms. And this is no judgment here. This is not about good or bad. I want you to think about, where do you spend most of your time? Are you in that fighting spirit? Do you fluctuate between feeling hopelessness? If you ever go to hopelessness, what do you do about it? Are you reaching out to people? So life is full of stress, right? Some we can control, some we can't. So controllable stressors are, can you choose your healthcare providers? Well, if you're in big metropolitan cities, you can, but if you're in small suburbs, sometimes you can't. So, it's important to find the healthcare workers that are available to you. And if that's something that you're struggling with during this conference, reach out to someone so that we can connect you possibly to someone who can work with you. And then which procedures to undergo, talking to your healthcare providers, what is the best procedure to have done? What we can't control is that there's acromegaly, and that you have acromegaly, and that you have to deal with this. And for your partners and children and spouses, that's part of the person that you have in your life, the person that you love, and working with them through this. And the fact that treatment is usually the best modality, and that you're going to be looking into what are those issues with treatment. So how do we cope with controllable stressors? We want to utilize strategy, problem solving, decision making, seeking information. This is all very healthy. You want to be advocates in your own lives to seek this. and feeling in control around making some of these decisions, right? I want you to be an active player in acromegaly. So how do we deal with uncontrollable stressors? And we know what those are. Now, we want to become aware of our emotional responses, maybe looking at how our thoughts affect our emotions and our behaviors, looking at how are you coping with things that are uncontrollable, what kind of activities that you can engage in. Are there any relaxation exercises, meditation, mindfulness exercises that you can incorporate as well? Not just focusing on the medication and the strategies towards surgery, but also looking at some of the things that balance your life. So how do we manage symptoms? Oftentimes we talk with patients that are dealing with symptoms, breakthrough symptoms. Despite receiving treatment, we deal with having to really monitor your numbers and how you all understand how that affects your overall well-being, whether it be fatigue, pain, looking at how do we manage those. And can those symptoms always be managed through medication? Are there other ways to manage them besides that? Getting good rest, eating well, exercising to the extent that you can per doctor's orders. What are some other remedies that people use? And I'm just going to kind of ask the audience right now. Anybody else focus on other remedies besides direct medications? Yes, in the front. Meditation, great. Acupuncture. Exercise, great. You were helping me with the boxes earlier this morning. That's exercise. Anytime we move our body is exercise, right? Very good. Anybody else? Yes, in the front. Yes, hi.
So I meditate as well almost every day.
Meditation.
I do yoga almost every day. Actually, pretty much every day I do yoga.
Okay.
I also work out. I do weights and stuff like that every day.
Great. So exercising, right? Meditation, a lot of people are talking about. Even stretching is considered exercise. You can just get a yoga mat and just kind of get on the mat every day, right? Even if it's just lying there and stretching your body a little bit. So it's very important. And for those of you that are new here, you'll learn from others that it's crucial to incorporate different remedies, not just focusing on the medications. So we talk about acro rage and we talk acro fog. And I didn't have this originally in my presentation until I started doing some more research and working with more patients that were dealing with this. And this is a reality. For those loved ones in the audience, there is times where, since the hormones are imbalanced, where someone has a very hard time regulating mood, and also that we find fogginess cognitively. So for those of you that aren't aware of this, especially family members, these are real. And it's something to acknowledge and be mindful of. It's not an excuse to kind of live in rage, but it's something that is important for you to regulate and see where you can regulate it as opposed to where you can't. So I'm going to talk a little bit about a theory that I like to use with my patients called cognitive behavioral theory. The idea cognitive, right? The mind, behavior, the actions that we take, and kind of all the emotions around that. So this is something that I like to use in my practice. It's very effective. And I also like to blend it in working with just listening to my patients, validating, being there, being empathetic, right? Because there's a lot of emotion. You sometimes can't put emotions into a pretty box of theory. But I'm going to talk a little bit about this. The idea is, and you can apply this to anything in your life, that there's a relationship between our thoughts and our emotions and our behaviors. So if you take life being a situation, usually that's a fixed situation. Let's say that's acromegaly, for example. That doesn't move. The idea is, what are your thoughts about it? How does that trigger how you feel about it? And then how does that affect your actions around it? So let's just kind of break it down a little bit. The situation is the diagnosis, the thought being, I'll never be the same again. How does that make one feel? How does that feel? Anybody? Pretty hopeless, horrible, fear. You're right. Fear, depression, sadness. And then if we move into then how does that affect how we behave? I may not want to show up at that family wedding. I may not want to show up at my kid's bar mitzvah. Whatever the story is. That's the theory. So a situation not change in order for us to change how we feel and also how we think about it. The way a person thinks about a situation determines the way the person feels in reaction to it. The idea of this is that if I change my thinking a little bit, it may change how I perceive things. Not always easy to do, but something to be mindful of. I struggle with this all the time. We all do. And just kind of, if I have what I call stinking thinking, or if I'm in negativity, I try to stop myself and say, whoa, wait a minute here, right? Or if I'm in anxious preoccupation. We'll take some questions towards the end. Automatic thoughts, these just come. They just wake up before we do in the morning, right? You ever think your mind wakes up before you do? These are thoughts that are so well rehearsed. You don't even think about them. They just happen. It travels quickly, and they usually precede any kind of behavior, but they're there. Those are the automatic thoughts. We all have them. So let's kind of identify them. The doctor office calls. What's your automatic thought? Something's wrong? Why would they be calling? Right? Right? What's your immediate emotional reaction? Just ask yourself, where do you usually go, right? Panic? Or maybe you don't pick up the phone and return the phone call. Maybe you wait a couple of days. Maybe you're in the coping mechanism of being passive. I don't want to know, right? And we put it off. Core beliefs. These are our deep, deep core cognitive beliefs. They're underlying assumptions about things. They're based on maybe previous events, maybe a past loss, a hurt, where somebody hurt us. They impact our interpersonal relationships, but they're core beliefs. Usually these start younger in life, but they can be very impactful, not necessarily from a parent. It can be from a teacher. It can be from somebody in the religious world. Somebody has kind of triggered us, and that's a core belief that we have. These are some commonly held irrational core beliefs. I'm helpless, I'm weak, I'm bad, I'm unworthy, unlovable. Well, we don't come into the world thinking that, do we? Where do we get this stuff? Notice what your core beliefs are when things come into your life. So we want to kind of dispute some of these thoughts. So if we go back to the theory, there's a situation. What is your thinking around this situation? So let's kind of dispute some negative thinking. Just because we think something is true doesn't mean it's a fact, right? All of those core beliefs, those aren't based in fact. Somehow we learn those in life. So oftentimes, I prefer using the terms rational versus irrational thinking as opposed to think positive. Don't tell me to think positive if I don't want to think positive, right? I mean, really, don't tell me to, change. That's pretty hard to do when you're not feeling that way. But maybe we can look at rational thinking versus irrational thinking, right? What's based in fact. And we're going to kind of look at telling the difference between the two, and you can ask yourself 3 questions. Are my thoughts based in fact? Am I unlovable? Is that based in fact, that thought? Does my thinking help me feel the way I want to feel? If I go through life thinking I'm unlovable, it's not a good way to go through life, right? You're not going to attract healthy people. You may even push away people that are in your life who love you. And does my thinking actually help me achieve my goals? Now, I know goals, I'm not talking about lofty goals. I'm talking about getting out of bed in the morning, right? As a goal. Showing up for my kid, showing up for my husband. That's what I'm talking about. If you answer no to any of these, you may want to consider changing the thought or challenging it a little bit. For example, doctor has called you to come into the office to update you on your prognosis. Irrational thought would be, I know it's bad news. Now, if we ask ourselves those three questions, we're going to probably come up with the no, right? Meaning that, is it based in fact? No, we don't know yet. Does it help me? Does it make me feel any better? No. Does it help me show up for my day? No. May not even get me to the doctor's. What about this thought? Doctor calls you to come into the office. I don't know what the news is, but you know what? I'm going to be able to handle it. I don't know what is going to happen here, but I know I'm going to get through this. I have my Acro community. I have Jill. I've got people in the audience that are going to be there for me. Do you see how we just changed the thought? Not always easy in the moment, but it's something to consider. How we change our thoughts, feelings, and behaviors. It takes practice, right? Nobody starts playing tennis and that ball goes over that net, right? So it's kind of being aware and practicing how we think about things in our life. Replacing new thoughts, noticing where you're going into that core belief of negativity, whatever that is. I can't do it, right? I can't do it. I don't know, does anybody have like a daily mantra that you use? I have. Does anyone have one? I have one I say to myself sometimes is, it's going to be okay. Right? Jill?
Serenity now.
Serenity now. I like that. I like that. Serenity now. When I'm in, yeah, go ahead, Mike. Oh, I like that. Trust yourself. Right. Yes. You are worthy. Sometimes if I find that this is a helpful, if one's feeling really overwhelmed and you have no idea what to do next, sometimes I'll say, just do what's in front of you to be done. Just what's the next thing I need to do, right? For those of you that live in the coping mechanism of anxious preoccupation, one of my favorite quotes is, be where your feet are, literally. Be where your feet are, right? Try not to be in an hour from now or in a couple of days from now. Visualization can be very helpful. People have been talking about mindfulness, meditation. Visualization is very powerful, used by very effective people, athletes, just making the basket over and over again. So visualizing, that kind of rational thinking. You could even visualize and play it in your head before you walk into your doctor's office. Right? Put on that coat of armor, that kind of psychological vest, if you will, as you walk in. I don't know what I'm going to be told, but I know I'm going to get through this. You can visualize all that stuff. Mindfulness, people have talked about this. This is much more common today. For those of you like me, I've got fat. I'm always thinking, my mind's moving at a mile a minute. It's pretty hard to kind of just drop down and just meditate, right? For some of you, maybe, to just shut that mind off. Mindfulness is a wonderful tool. It's an active piece of calming the brain. And there's many, you can Google, there's many wonderful techniques of mindfulness. So practicing techniques, physical practice, while mental practice is very useful, being physically able to perform action. For example, you have a fear of public speaking, try it out, give a little pitch somewhere, show up at a meeting, raise your hand, ask questions. Those are all action steps towards moving it out of the fear. So, how do we kind of challenge these thoughts? We practice, we want to have desire, we're mindful of it. The more and more you do it, the better it grows. Practice, practice, practice. I want to go over something called cognitive distortions. These are, again, different ways of how we think and how we cope in a way that does not help us propel in our life. Anybody go into all or nothing thinking? Right? It's hard to be in the gray, just being an all or nothing. If I can't do the things I used to do, why is life worth living, or is life worth living? Maybe you reframe the thought. I can't do some of the things I used to, but there's many things I still can do. Be aware of these are cognitive distortions. Anybody catastrophize? Anybody know what catastrophizing means? Blowing things out of proportion, right? Making a mountain out of a molehill. Now that I have this illness, my life is over. How is that going to make you feel if you have that thought? Is it going to help you get out of bed in the morning? So notice around cognitive distortions. There's no evidence of that. If only. This goes into being a victim. We don't want to be living in victimhood, right? Especially not if you have acromegaly and if you're part of the acromegaly community, because no one's a victim in this room. We're advocates, right? We fight. And this community are the biggest amount of fighters that I have ever worked with, because you have to fight. You have to fight and move through the things that you need to. You need to talk to your physicians. You've got to fight the insurance companies, right? You're constantly climbing Mount Everest. And so it's real important to stay out of, if only I had done this, if only I had done that. Keeps you stuck in the past. Past is gone. Keeping stress under control. I always like to say per doctor's orders, and whatever that looks like for you. Be aware of toxic relationships. Be aware of toxic work environments. Are you not being supported at work? Are you having to constantly fight with individuals or speak up about needing to take a day off, right? Look into how to live your life the most successfully with this. Take good care of yourself, drink water, sleep. There's so much research on sleep today. We need to sleep. We need to quiet the mind. We need to move your body, right? As much or as least as possible. And we need to play. We need to have some fun. So this hotel has like a happy hour from 5 to 7. And it was so great to see a lot of you at the bar last night. You guys were laughing. There's a lot of lightness. I mean, life is heavy. Acromegaly is heavy. Medication is heavy. All of this stuff is, but you've got to balance it with having some fun and some play. And so at this conference, I want you to connect with each other, connect with people that you've not met before, go up to someone who's new and reach out and, have some laughter. Support groups, that's why we're here. Support groups are huge and are needed. There's a common denominator that I don't share with you. Physicians, pharma, we're not in your shoes, right? You need each other. It's crucial to continue climbing that mountain, because you're all there with your backpacks on, climbing that mountain. And right, someone's going to slip back and you got to help the person get back up, and right? So it's really important to stay connected and utilize support groups that are healthy, that push education, advocacy, and support. There should always be that in support groups. Here's my favorite quote. I always end with this. Watch your thoughts, they become your words. Watch your words, they become your actions. Watch your actions, they become your habits. Watch your habits, they become your character. Watch your character becomes your legacy. And those are those that are coming into the world next, right? Whether they're your own children or nieces or nephews. So your thinking has a lot to do with how you live your life, live with others, and what you push out into the world. All right. So congratulations, everybody, for being here. Thank you, Jill, for having me. Thank you for everybody in this room. We'll end here. Are there any questions? We have time. Yes. In the female, yes.
You mentioned about CBT,
Mm-hmm.
cognitive behavioral therapy.
Mm-hmm.
Do you suggest that because this is a challenging disease
Mm-hmm.
with the treatment?
Yeah, thank you. So the first question is, as far as therapy, psychotherapy, seeing somebody to kind of, complement the other, treatments that you do. I think psychotherapy is very useful if you're having a hard time functioning, right? And when I mean functioning is that if we move into depression, severe anxiety, it will affect functioning. And that I keep saying that as simple as getting out of bed in the morning or showing up. So I think if you or someone as your loved ones notice that about you, that I think it's time. That's when it's time to seek someone to talk to. CBT happens to be one theory that's out there as a tool that sometimes therapists use. I think it can be very effective, but I think actually what's even more preferred is finding a therapist that can connect with you, build rapport, validate you, and understand you. I think that is more important than a specific theory. This is a tool that I happen to like. I think it can be useful in all areas of life. So I think you're the best judge, or all of you are the best judge of where you are in your process. But I think it can be helpful for periods of time. I don't use apps. I'm kind of old school. I like to be off my phone and computer as much as possible. So I may put that out there to the audience. I'm more of visualization that I use routinely over and over again. But I know there's wonderful apps out there that can be used. Yeah. Yes, the gentleman in the front.
So do you find when you're counseling patients that if they can manage to take one baby step, one foot in front of the other, and take an action even though they feel differently, that over time they will feel differently because of the action was different?
Absolutely. So if we go back to the diagram where it said situation, thoughts, right, feelings and actions, so that situation's not going to change. Let's say it's fixed, whatever that is, whatever that loss is. Yes, if you move, if you focus on the action of just moving in a direction, that will ultimately shift your feeling and your thoughts. Excellent. You're absolutely right. Absolutely. That's why I always say, get out of bed, get dressed, show up. Just show up. Do what's in front of you to be done, even if you don't feel like it. Exactly. I'm going to give a quick example. I was at the airport yesterday and I got a crisis call from a new client. Never talked with her before. She was crying. She was feeling awful. She was in hopelessness, helplessness, really in bad shape. And in 2 hours, she had to show up at her daughter's school to meet with the school counselors to talk with them about kind of, I guess the point of, she was speaking with the head of the schools to talk about how great her daughter was, so to educate them and get her into the next school. Does that make sense? It was part of in the private world to do that. And she was so struggling and wanted to cancel, and it was her second time canceling. And so the work that I did in that hour with somebody sobbing was to listen to her, validate how she felt, but I want to get her ready for that 1:00 meeting. So I focused on that. Does that make sense to everybody? Talked about how she was feeling, but then I moved her out into, okay, start telling me about your daughter. Tell me, I wanted her out of that loss. Tell me about your daughter. What's so great about your daughter? You know, why, how, you know, and then she was ready to go. So I moved her into action. Yes.
What would be like an accommodation that person could have asked for within that committee to be able to accommodate their needs?
I'll say that again. I can't hear you. It's just because of the mask. Can you, did you say accommodation?
She had asked from that meeting to meet her needs for anxiety needs. Because she's going to a meeting at that effect, right?
Right.
And if somebody has anxiety or stresses of that nature,
Yeah.
they would need to accommodate to that. So what would she have asked for?
Well, good question, because her mother had died 2 weeks ago. So her mother had just died, and she's a single mom with an 11-year-old. And so she was worried about, well, what if I start crying in front of this academic team? And I said, that's okay. Your mother just died. It's also okay to tell them that. But I also want you to tell them how extraordinary your 11-year-old has been watching her grandmother die, and how she's going to take that into the high school. I don't care. I appreciate that you're anxious and you're sad, but you got to show up too, if you can. I was able to move her to do that. I was able, you know, she had gotten out of bed and had showered, and I asked her. She hadn't eaten yet. Does that make sense?
Yeah, I just wonder if sometimes in those situations somebody would have you to talk them down.
Yeah.
So maybe requesting having that meeting in writing or on a Zoom or something other than in person.
Absolutely. She had canceled one already, so that's why I really wanted her to show up. But you're absolutely right. If you can show up, if you really can, if you're in too much physical pain or an emotional pain, advocating for a different route. Can I have it on Zoom? Can I have it in writing? Absolutely. Because there are days that we can't get out of bed, that somebody, right? It's too painful, or you're just really feeling bad. And you have to also kind of balance the baby steps and taking care of yourself in that way. Yes, in the red.
We're finding out that it's very difficult to find counseling that understands this condition. Even with insurance, it's weeks and weeks of waiting. Is there a place you can go, or a place that has a central location to find counseling that can help?
Yeah, I'm so glad you brought that up, because not every therapist out there is going to know what acromegaly is. They may not even know, anything about pituitary disorders. And I think in smaller areas, it's harder to find educated therapists. I would recommend finding a therapist, whether it's on an insurance panel or a counselor at a local clinic that has experience with grief and loss or chronic illness. So if you have to look for a therapist that specializes in something, I would target those areas. They're not going to know what acromegaly is. And unfortunately, as a lot of you know, you have to educate healthcare providers, right? And isn't that awful, right? I mean, you've all been there before. I have brought this up to other patients that if you do have a therapist that doesn't understand the disease, or you want to start a therapeutic relationship, I would be more than happy to offer a call to that therapist to educate them a little bit. Please know that. And I can always be reached through Jill if I can help with that advocacy. It will not take time off me at all. It would be of service to you, and the therapist should know about this. And that's why we're here today, to advocate and to educate. Yes?
On a very similar topic, when looking for a therapist, do you have any tips from your side of like how a patient can go through these lists of, people in their area and look for somebody who's a fit, something that's, maybe better than just reading their bios?
Absolutely. So this is what I would recommend. Depending on where you live, distance may be a big variable. I mean, do you want to drive 20 miles away or 5 miles away? And that may not be the right fit for the person, but I mean, I'm coming from talking about Los Angeles, where, 5 miles is 3 hours. So geography is important depending on where you are. I think it's important to decide, do you want a man or, male or female, right? I think that's important to decide. And I think rather than reading bios, everybody can write a bio. I would recommend that you get on the phone and you call the therapist. And you have a couple minutes of just checking them out on the phone. Do they take your insurance? Do they have any experience with chronic illness? Those are the questions that I would have. And I would call as many as you can until they call you back. That's exactly what you do. You just go down that list. I think that's what I would recommend. Yeah. Yes, Bella.
So one of the things, so I have an EAP program, right? So I'm taking advantage of free things. So I talked to we did like our initial interview is what I like to call it. And I'm like, look, I have acromegaly. I'm going to send you some links before we meet. Can you please read up on this and make sure you understand our mental, so she was like, send me everything you got before we meet.
Okay.
So she was incredible and wanted to learn about like our trials and tribulations. And I figured if she wasn't willing, then I'm going on it.
That's right.
Like if you're not willing to learn about my background, I'm not going to be talking to you. So that's one of the things I think I would recommend is try to have those conversations before you get invested.
Absolutely. Very good. Excellent. So Bella just mentioned an EAP program that stands for Employee Assistance Program. Some companies will have those for their employees, and oftentimes those services are at no cost to the employee. And she just recommended, before engaging in a therapeutic relationship, ask the person, do they know about acromegaly, and would they please read up on it before you start a session? Yes.
Is there any kind of playbook around that it's, this is like, this is what you do first, and this is what you work on second, and this is what you work on third, and that way people can maybe measure their progress and see how they're progressing?
Do you mean in a therapeutic environment, or the progression of just one slide?
In a therapeutic environment.
Yeah, good question. So typically, if you engage in a therapeutic relationship with a psychotherapist, they create what's called a treatment plan, right? Similar to a medical physician or a care plan. Typically, we want to start with what's going on, how are you doing, right? And identifying some of the goals that you want to work on. I think the most important thing, though, if you do start with a therapist is, the therapist's responsibility is to establish rapport and trust and empathy. I want you to feel comfortable and safe in an environment where you can share things. Everything is confidential, by the way, in a therapeutic environment, except for 3 things: harm to self or others, elder or dependent abuse, and child abuse. Other than that, everything is safe within that relationship. So I think that's the first thing. You got to feel safe and trusting to come back. And then you would work with that therapist on what some of your goals are. For example, since I've had acromegaly, I don't accept any social engagements. So I would be all over that. I would be like, okay, and I would take baby steps and break down those large goals into real small ones, right? Nobody goes out and runs a marathon. You start walking, right? So does that answer your question? And you would work with that therapist on identifying that plan of action.
Thank you.
Yes.
So there seems to be a shortage of experienced therapists, at least in certain areas across the country. And so when patients finally find somebody, or maybe they just decide, well, whoever you're going to offer me, maybe it's rather than somebody with many years of experience, somebody who's brand new or going through a program. What red flag should a patient look for
That's a great question. I think in any relationship with a psychotherapist, red flags would be if they're not available to you. You know, if they're difficult to schedule an appointment with, if their practice is so busy they don't have time, if you're in that therapeutic session, if you don't find that you're getting validation and empathy and connectiveness, those are all red flags in my opinion. I wouldn't want to waste my time or money with someone. It's such a sensitive and vulnerable environment to be, you know, and you have to feel safe. So I think those would be definitely red flags. They have to meet your needs. But I don't want people to think that you have to have a therapist that knows everything about acromegaly. They're just not going to, unfortunately. But I think chronic illness, grief and loss, interpersonal relationships is really what you want to look for. And I would say most insurance panels would have those types of therapists. Yes.
I wanted to make a comment to the folks who have been here for years and to the new people that the Facebook groups that are available specific to acro are just awesome. Because when I was first diagnosed, I pretty much didn't engage. I just kind of read people's stuff, and then I kind of picked out people that I kind of made my heroes.
Mm.
And when I would be undergoing something, I'd think, well, Stacy did this, Jill did this,
Mm-hmm.
Judy did this, Bert did this, or look at what this newcomer did. But there's so much, you can go on there and you can vent,
Mm-hmm.
or you can find answers. These people are absolutely loving. And some of you cry.
Yeah.
But it's just awesome.
Yeah, I'm so glad you brought that up. Thank you very much for bringing that up. Yeah, thank you for bringing that up because Jill's done such an incredible job with that page and making it be a safe space. And that's just a reminder for all of us on, you know, the path of life, you know, to stay focused on things that are working for you. Remember, not all medications work for everyone. Mindfulness may not work for one person, you know, something else will. So, and kudos to you for taking the action step of reaching out on Facebook and connecting with people.
It's huge, y'all. I mean,
But by you doing that action step, you changed your thinking and your thoughts, and here you are, and you know, it'll help other people. Your sharing will help other people do the same.
and everybody shares.
Yeah.
You know, and there's no push to share. Like I said, I didn't talk or do anything for like a year.
That's okay.
There's so much in there, and there's a lot of grace and mercy and love. We are a family. And it's like, you can ask weird stuff, you can do whatever you want, you know, and we've got women's groups, caregiver groups, men's groups. I mean,
Yeah.
that's what we're all there for, and it's unbelievable.
Yeah, and I think those social networks are huge ways to stay afloat. If you're really struggling with individually and some hardcore cognitive distortions and depression, that's where individual therapy can be really good, you know, if you need that. But the support groups that you go to, that's really a big piece of it. There's a hand in the back. Yes. Oh, good question. So I can speak to that. It is, and this is, I think, where, you know, being advocates of your own healthcare come into place. Oftentimes, if you have many doctors, many specialists, right? Sometimes they don't all talk. Ever think of that or heard of that before? So, as the patient, once again, it's important to make sure that if you have an endocrinologist, right, and a primary care, and you bring on board a psychiatrist, and that psychiatrist wants to prescribe a medication, you've got an endocrine prescribing, boy, they need to be in communication. And they won't know to do that because sometimes that endo doesn't know that you've brought on a psychiatrist. You've got to be the one to communicate, right? Especially if they're both prescribing medications, because we don't know about what the interactions of the medications are. So that's critical. The good news today, major healthcare systems have online charts. They have portals where physicians can communicate, but in smaller institutions, that may not always be the case. Does that make sense? But it's really important to especially when you've got many different doctors prescribing different medications. Yes, again.
One more question. So, do you feel for a patient with acromegaly, as far as privacy issues, that it might be in their best interest to have a private psychiatrist that is not in the big system? Or is it better to have them in the big system where they might be prejudged? Like their medical records.
Okay, interesting question. I think my gut goes to that your treatment team should be in good relations and in good communication. But if there's been some history of confidentiality issues or being prejudged, there is nothing wrong with finding a psychiatrist outside that system, outside that healthcare system. It's about what makes you feel safe and comfortable. That's what's important. So that's totally fine to do that. Healthcare systems, of course, will all want you to stay all with the same one, right? But it's more important for you to get the effective care and treatment that you need and deserve. Yes, Stephen in the back.
One thing I wanted to mention is certainly there's a significant change with COVID over the last few years, and Zoom is a very effective mechanism as well as other ways of getting healthcare online. So people should look more broadly and try to find the right relationship within a community where there's availability. We've had a dramatic shift in the numbers of providers effectively using
Yeah. Great, thank you. Then everyone, that was Stephen Jaffe. He will be the psychotherapist running the men's group later this afternoon. Thank you for bringing that up. With COVID, telehealth has skyrocketed, and oftentimes we're doing a lot of Zoom therapy sessions. I'm certainly doing a lot of that, and that can be just as an effective tool. How are we on time? We're going to wrap up?
Yeah.
All right, we're going to wrap up at this point in time. I'm going to bring Jill back on. Okay.
Isn't she amazing? Give her a hand.